Okay, everybody, we're going to talk about the treatment of stuttering in adolescents and adults. So the goals for adolescent and adult fluency is really to cope with their learned behaviors and learn how to speak more fluently. So we want to help them decrease their fear of stuttering, help them eliminate escape and avoidance behaviors, and then control their fluency and use a controlled, mindful form of fluency to replace stuttering. So we want to help them reduce any muscular or laryngeal tension they have and help them slow down their speaking rate and feel like that they are in control. And in the moments where they feel like they're really tense, help them realize that they're in that moment of tension and then help them relax. We have talked about this before, about how the client needs to become their own clinician and they need to master those fluency modification and fluency shaping techniques. So all the techniques that we talked about in the modification and shaping can also be used with adolescents and adults, and they have to learn these techniques and be able to use them themselves for them to be effective. So some things to think about with clinical procedures is the treatment of adolescents and adults usually takes a really long time. It demands considerable motivation. So think about, I've seen quite a bit of teenagers whose parents bring them to therapy and they don't have any motivation to want to work on their speech. And so if they don't want to work on it, then you're not really going to get very, very far because they have to be motivated themselves. And they have to maintain their focus on many fronts. Your treatment should be individualized and tailored to each client's needs. I've seen a lot of fluency clients, and every client is very different in what their needs are. The third thing, a successful outcome of treatment requires focused attention to speaking, especially when they're about to anticipate they're going to stutter. They really need to focus on what they're feeling, how it feels, to be able to transform it into something smoother. Number 4, successful outcome of treatment depends in part on increasing approach behaviors and reducing avoidance behaviors. So we've talked quite a bit about, reducing those avoidance behaviors. And then the measurement of progress and outcome are really important because, like we talked about the other day about discharge, we really have to track progress with these patients. Like with any patient, we have to track progress because a lot of times these patients will want to continue therapy even when we can't show progress anymore. So that's something to be aware of. So when you first get an adolescent or adult client, it's very similar to what we've already talked about. So the first step is we want them to understand their stuttering. So we can give them handouts, and we just want them to start to realize what it is that they're doing and identify any secondary behaviors and identify what types of disfluencies they're experiencing. Then another thing we do is approaching and exploring stuttering in the treatment room. So the client clinician can catch and hold stutters, and the client learns to feel what they're doing physically when they're in the moment of stuttering and learn to reduce the tension during the stutter. So we can do this in the treatment room, and then we also can do this outside of the treatment room. So the client clinician observes stuttering and the client's reactions to it outside of the clinic. And as the stuttering is studied, the client tries to catch and hold stutters outside of the therapy room. Continuing discussion of how the client feels about their stuttering. You can audio record them in various situations, followed by discussions with the clinician. So using feared words and entering feared situations. So like we've talked about, Many adolescent and adult fluency clients will tell you what words they don't want to say, or if there's certain sounds that they feel like they have a lot of difficulty saying, or certain situations, like Lane was talking about certain situations that he did not want to put himself in, like ordering from a restaurant. And so we need to practice facing those fears with them and helping them come up with strategies to help reduce the fear of certain words and sounds. So they can maintain their improvement by becoming their own clinician and maintaining their fluency goals. And so you as a clinician are trying to teach them to become their own clinician and use these techniques in their everyday speech. Okay, support groups. Support groups can be really helpful. There are several different types of support groups. We see support groups, adolescent support groups, adult support groups. Some are for parents of children who stutter. There's a variety of different types, and you can imagine how helpful certain types of support groups will be for certain groups of people. And it's really nice for people to recognize that they are not the only ones out there who stutter. People can get a lot of sense of I'm not the only one when they attend a support group. Sometimes there's community support groups. A lot of times you'll find support groups at universities and clinics similar to our own. They will have fluency groups, support groups. Okay, so I know we've talked a little bit about the SpeechEasy device and how it's a delayed auditory feedback device, and you all have seen Lane's actual device too. It's working on the principle of choral reading. So when someone who stutters says something at the exact same time as somebody else and the exact same thing, they don't stutter. And so the makers of this device tried to capture this in a small hearing aid-like device, and it's at an altered frequency as well. So it's like several hundred millisecond delay. So if I say, hi, my name is Megan, what I'm hearing in my ear with the device on is, hi, my name is Megan, a few milliseconds later. So if any of you have talked on I think we've talked about this, I think on the first day of class, if any of you have experienced talking on your cell phone and you hear an echo of your own voice, it's like that, but the frequency is higher. So I've had clients tell me it sounds like a mouse is talking in their ear. Now, there are pros and cons to these devices. Sometimes I've seen people that it works for them, and some people it doesn't work at all. But the bottom line is that it is not a miracle cure. You cannot pop it in your ear and all of a sudden become fluent. And if you search on the internet, they have YouTube videos that will show that people are, like on the Tyra Banks show or Today's show, they'll show people crying and how they'll pop it in and they're fluent and how it's a miracle cure. If they're fluent immediately, that's great, but it may not last. They also released it before there's a lot of research that's been completed on the long-term effectiveness of it. So we need more unbiased researchers to examine the effectiveness. Also, remember we talked about the adaptation effect. So when you hear a noise, after a little while you start to tune out that noise. It's the same type of thing with the SpeechEasy device. Okay, so things just to make clear to interested patients: we don't know the long-term effectiveness of it. It only works when you're wearing it. It fits like a hearing aid, but it's difficult to hear through one ear when you wear it. A lot of people have reported that it picks up background noise, so they have a lot of trouble wearing it in restaurants and other noisy environments. Okay, it typically is used for adults. So it's just really important for you as future speech pathologist and audiologist to be aware of current trends and research with the Speech Easy device. And last thing, it works best if you use it with therapy techniques like the fluency shaping and the fluency modification. Okay, so there's lots of links and resources you can use for working with people who stutter. They're the Stuttering Foundation of America, the National Stuttering Association, the Stuttering homepage, the National Association of Young People Who Stutter. All of these are really great websites that have a lot of resources for professionals, for speech language pathologists, and for clients who stutter. This link is really great for therapy materials. It has every type of therapy material for in our field. It's got a lot of fluency materials, but it's something that if you're a clinician, you should definitely check this out and see if you can find any helpful resources here. If you're working with people who stutter, there's lots of workbooks and clinical resources, and I have some of them listed here. There's quite a bit out there.